South Africa is the country that has suffered the most from the AIDS epidemic. The disease killed 350,000 last year. Many people are hoping that this summer's World Cup will provide the kickstart needed to end the pandemic. We were exclusively allowed to film in the St Mary Hospital in Durban, where 75% of patients are HIV positive.
AIDS is really an unspeakable tragedy, especially when you think of the women and the children. And now there are so many AIDS orphans. And we have been trying to keep the mothers alive through we call it the PMTCT program, which is prevention of the transmission of the virus from the mother to the child, and have actually very good results with that. 95% of the babies are HIV negative, and that's very good.
In a country that a few years ago refused to speak about AIDS, the taboo around the subject is finally lifting. In the garden of the St Mary Hospital, we meet 28-year-old Nomumpulelo and her 7-year-old daughter Smangele. They are both HIV positive and found out after a regular checkup.
Smangele starts to have glands, then I go to my nearest clinic, then they send us to hospital Maranhill. We started to test, then Smangele, the result was HIV positive and my result was positive too.
Why didn't you use condoms?
In that time, I didn't know everything about HIV because I was so healthy, big, and my boyfriend was healthy too. That's why I never use condom.
The biggest screening and awareness campaign ever held in South Africa has been launched for the World Cup. The president, Jacob Zuma, who is openly polygamous, has been tested and assures everyone that he is HIV negative. More than 1 billion condoms have been distributed and the campaign is starting to see results. At the St Mary Hospital, 300 new patients arrive every day for treatment.
Because we have a very broad-based epidemic with between 5 and 7 million South Africans that we know theoretically that are HIV positive, and it's really important for people to know their status. If they're positive, then we can work out how far they are in the disease and offer them the option of treatment. And if they are negative, then we can encourage them to pursue lifestyle that will keep them negative. Europeans, they came to Durban and they visited us. And one of the spin-offs of that, it's an opportunity not just to deal with, you need an HIV test, please have it, but a whole lot of other issues that come around it. And in South Africa, there are still, we've had tremendous sort of educational initiatives that have gone throughout the country, but there's still, how shall we say, rumours or myths, this belief that if you have sex with a virgin or someone who's HIV negative, it will sort of cure you of your HIV or dilute it.
In theory, 15 of the 45 million South Africans should be tested in the coming months. It's a very ambitious project, but if it works, it could cut in half the number of new cases in 2011.